Good morning. I will perform the medication administration. I will show you my school ID. My name is Ivy Luzon Luz-Cab. My student ID number is 382292. It is written at the back. Now I will show you my right side here. And then this is my left side here. Now, before I will proceed, do have here, I will show you my scenario. So there's no rating at the back. And then my doctor's order. This is doctor's order, there's no rating at the back. My MAR here, there's no rating at the back. And then the monograph, 2 pages, there is no rating at the back here. So this is the monograph, which is no rating at the back. So now this is my label. There's no rating at the back and front. So this is I'm gonna use later on. So now before I proceed, I'm gonna wash my hands. So I'm gonna wash my hands. I will verify. I will show you. I will read or I will highlight the scenario. So the scenario is I am the practical nurse to Mrs. Martha Parks, who are pulling in the park, walking her dog, broke her hip. Yesterday, following her right hip arthroplasty, she was admitted to our unit. She has been hesitant to comply with mobility as she is nervous she will fall again. I am tasked to administer medication to Mrs. Martha Park, her 9 o'clock medications. So now I will verify the doctor's order. So Bubali College Hospital, MRI number is 1212392. Patient's name Parks Martha, female. The gender, the physician is Anderson Lewis. Room is BBC 408. Date of birth 1956 February 20. Allergy is sulfa drugs. Primary diagnosis is right hip arthroplasty, medical history type 2 diabetes, arthritis, and pernicious anemia. Then weight is 60.5 kilogram, and then the height is 180 centimeter. Goal of care is M1. All clinically appropriate medical and surgical intervention directed at cure and control of conditions are considered, excluding the option of attempted life-saving resuscitation followed by ICU care. The physician's order as follows. Date time was yesterday, that was November 29, 2020 at 11 o'clock in the morning. Vital signs every 4 hours times 48 hours and then routine. Glucometer testing, QID or 4 times a day. Simple solid 1 gram. IV every 8 hours times 24 hours then discontinue. Humulin R, subcutaneous 3 times a day sliding scale with meals as follow. Humulin in 6 units subcutaneous at 8 o'clock. Heparin 5,000 units subcutaneous BID or 2 times a day until ambulatory. Cyanocobalamin 1,000 micrograms subcutaneous monthly. Lactulose or 15 ml POBID PRN. Morphine sulfate 2.5 mg to 5 mg every 6 hours subcutaneous PRN. In and out catheter every 6 hour PRN for urinary retentions more than 400 cc. Insert in dwelling and urinary catheter after third in and out. Catheterization and notify the physician. Daily dressing change starting today. Cleanse incision with normal saline and cover with the sterile dressing. Clear fluid diet, increase as tolerated to diabetic diet. Weight bearing as tolerated. PT consult and the labs are CBC, SGA1C, and PTT. Signed by Lewis Anderson, MD. So now I will verify the mark of the patients together the doctor's order. So the patient's name Parks Martha, female. Hospital number is 1212392. Date of birth is 1956 February 20. So at 9 o'clock is cyanocobalamin 1000 micrograms subcutaneous monthly. So now I'm done checking or verifying the doctor's order and MAR. So I will verify the allergies of the patients, which is she's the allergy for the sulfa drugs. So now I will do before administration of the medications, I will do the first check of medications administration, so which is the 7 rights. So the 7 rights is a right patient, so which is my name is Martha Parks. Then right drug cyanocobalamin, right dose is 1000 microgram. Then right the route is subcutaneous. Right date and time is to November 30, 2020 at 9 o'clock. And then the right frequency once a month. Right reason is for the pernicious anemia, and then right documentation. So now I will calculate the right dose for the patients, the right dose for medications to the patients. So the formula is the desired dose over drug on hand times quantity equals to the amount. So the desired dose is 1000 microgram, and then the availability or the drug on hand is 10,000 microgram times ml times 10 ml equals to 1 ml or 1 cc. So 10,000 divided by 10,000 microgram, 1,000 microgram divided by 10,000 microgram times 10 ml equals to 1 cc or 1 ml. So that's the desired dose. So now I will gather all the materials that I need. So assuming this is my vial, assuming it's not yet open. So this is open already because I practiced earlier. So assuming this is not yet open, so this is my vial. Cyanocobalamin injection, 10,000 microgram per 10 ml, and then the expiration is August 2025. So, cyanocobalamin injection, 10,000 microgram, then per 10 ml, and then the day expiration date is August 2025. I mean, now I do have here the syringe. Assume it's not yet open. This is a 3 cc. So the expiration date is 2024 July 31, and then I have this needle, the pilled blunt needle. So assume it's not yet open also, and then I will and then another needle which is gauge 25. So the needle gauge for the size needle for the subcutaneous is gauge 25 and 27, but my availability is gauge 25. So I have this hand sanitizer, the cotton balls, and then the alcohol swab, and then medication tray, and then the clean gloves, and then also I do have assuming this is the sharp container. Now after gathering, so I'm now ready to prepare the medication. So I will wash my hands or sanitize my hands. So now I will open the vial. So okay, I will open this one, the vial, and then I do have a garbage here at my side. So now I will open the alcohol swab, and then I will clean the vial in a circular motions with at least 30 seconds. So I will clean the vial here. Okay, so now I will open my syringe, the 3 cc, and a banana peel. Like a banana peel, you have to open the pack of this one. So this one, right? Now, so I will grab now my the needle, the blunt needle. So okay, like a banana. So I will open this one. Okay, so I will grab the 3 cc now. The syringe, the 3 cc syringe. Then I will attach this one to the needle, the blunt needle. So maintain the sterility. So secure this one. So this is now the syringe. So I will slowly move this one, the syringe slowly moving. Okay, not to loosen the syringe, I mean. So now I will extract air into 1 ml. So this is 1 ml. So I will extract air until here. So the line here, the black one, the first line, it should be in a 1. So now I am ready to inject this one to the vial. So I will remove the cup. So this is the cup, and then I will insert this one to the vial. So I'll just make it sure that I can see the center of the vial. So here. So, sorry. So I will introduce, no, I will insert the needle to the vial. This is it. So now, I will introduce the air to the vial, and then I will withdraw the medications, the drugs from the vial going to the syringe at 1 ml. So this is it. Okay. Here. So this one here. So this is the 1 cc. It's here. Okay. Yeah. Yeah, sorry, because I cannot see properly because of the lights. We don't have enough lights. So here. So now I will remove this one. Alright. So I will check the bubbles. If there's bubbles, I will remove this one. The bubbles, I will tap the syringe with my fingers. Okay. Now I will recap I will recap this one. The needle. Recap the needle. So here. So this is the needle. So I will hold a little bit here. Then I'll do quickly like this. So recap. Now I will change the needle from my filled blunt syringe to the gauge 25 that I'm gonna use to inject to the patient. So this is assuming, so this is my needle, the gauge 25, assuming this is not yet open. So I will open the banana, right, like this. So now, so I will remove this one and discard. Open, and then attach this syringe to the 25 gauge. Okay, this is it. Okay, now I will prime the plunger or the syringe, the medication. So that the medication will come into the needle, and then you cannot introduce air to the patient. So I will prime it towards the needle slowly. So it's already here, the bubbles, the medication came out already. So I've done priming. So now, so I've done priming. So this is ready for injection. So I will do now the second check. So the second check, so the 7 right. So check right patient, which is Martha Parks. Then the right dose is 1 cc. Right drug, cyanocobalamin. Right frequency once a month. Then the right date and time is November 30, 2020. Then the right reason is for the pernicious anemia, and then the right documentations. Now I will make now label to the, make label. So I will grab my pen. So here. So now I will write in the label, I will write the name of the patient, which is Martha Parks. Okay, Martha Parks. And then the drug, cyanocobalamin. And then the dose, 1 ml. And then the frequency, the date and the time is 11/30/2020 at 9 a.m. or 0900. And then my initials, IB Luzon or ILC, IB Luzon Dascabrios, then my designation, practical nurse learner. So now I will show you this one. So this is my label. Martha Parks, cyanocobalamin, 1 ml, 11/30/2020, which is the date and the time, and at 9 o'clock. And then my signature, my initial, ILC, PNL, IB Luzon, Dascabrios, practical nurse. Now I will put this one into attach this one to the syringe here. So this is it. All right. So now I will do the third check. So the third check together with the MAR. So with the MAR. So my MAR is here. So I will do my MAR. It's here. Okay. So patient's name. Okay. mark against the patient's level with the medication. So Parks Marta or Marta Parks, female cyanocobalamin, 1 ml subcutaneous. Then the date and time is 11 November 30, 2020 at 9 o'clock. The sign by I have the initial, Ibuloson, the Scabrios, then practical nurse learner. So now I'm done checking my third check. So I'm ready to proceed to bring my medications, to administer medication to the patient. So I will put my medications here, my alcohol swab, my cotton ball, and then I will bring also my medication record. So now I will knock the door of the patient. So knock knock. Good morning, mom.
Yes, ma'am. Good morning.
My name is Ivy. I'm here. I am your practical nurse today.
Okay.
I am going to administer the medications
Okay.
For your anemia, which is cyanocobalamin. Is that okay?
Okay, ma'am.
And is that okay to proceed?
Oh, yes, ma'am.
Okay, okay, ma'am. So is it okay that I will put my medication in your lap?
Okay.
If you don't mind.
Yes.
Thank you very much. So before I proceed, so I will make it sure that I will provide privacy to the patients, close the curtain, and then I will raise the weight at the beds until my waist level, which is the working height, and then I will raise the side rails, then check the break of the patients. So now, then I will identify the patients through the unique identification of the patient. So I will ask the patients, ma'am, can you state for me your complete name, please?
Marta Parks.
And your date of birth, please.
February 20, 1956.
Okay, thank you so much. Then my second to identify the patients is to check the ID band, and then also together with the MAR. So Bubali College Hospital, name of the patient is Park Marta, female, hospital number is 121-2392, date of birth is 1956 February 20. Now the room is 408. So now I'm done checking this one, the identity. So now I will ask the patients. So I will assist the patients and also the size. So ma'am, do you have any allergy for the food?
No, ma'am.
Any allergy for the drugs?
Yes, ma'am. Sulfa drugs.
Okay, thank you so much, ma'am, for your answer. So now I will do the assessment, second assessment. Can I open this one, sir?
Yes, ma'am.
Okay, and then your shirt. So is that okay?
Yes, ma'am.
Okay. So now I will assist the site of the patient, the injection site. So the injection site is no redness, no rashes, or no bruises in the skin site, in the skin or in the abdomen. So I'm choosing the site for my injection is the abdomen. So and then the skin is intact. So now, and then also I will assist the site of the skin of the patient. So if it is a really fatty, if she is a tiny or not. So if she's fatty or masculine, use the 90-degree angle to inject. And then, or not, if she's tiny, 45-degree angle for the subcutaneous. So now, first I will wash my hands before I inject the medications. Then I will put my clean gloves. Okay, so I will put my clean gloves. So I will, while putting my clean gloves, so I will verbalize that I will choose the side, and then I will do markings. So the three fingers of my 3 fingers, I will put the side of the umbilical line, the umbilicals at the side. So this is my my site landmark for where I inject the medication. So assuming this is now the medication site. So I will clean this one with the alcohol swab. Then in the circular motions, and let it dry and air dry. So now together or with my non-dominant hand, I will pinch the skin an inch. This one. And then the non-dominant hand, I will hold the plunger or the syringe. So I will remove this one now. Okay? So this is my non-dominant hand, and then I will pinch. Okay, sir, ma'am, at the count of 3, can you take a deep breath or inhale, exhale, then I will poke you. Alright?
Okay, right.
So 1, 2, 3. Then I will poke, insert the needle, and then I will then slowly introduce the medication, push the plunger slowly, 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 slowly. So until you feel there's a resistance, so it means that you done already introducing the medication, and then grab alcohol, cotton alcohol, then slowly slowly remove the needle, and then discard this one to the sharp container, and apply gentle pressure to the side. While applying the gentle pressure, give health teachings to the patients. Ma'am, report any discomforts or pains, burning sensation in your injection site.
Okay.
Then, if you feel difficulty of breathing, report. Just let us know.
Okay.
And then any diarrhea, nausea, vomiting, also report. Also inform us.
Okay,
Is that
ma'am.
okay?
Yes,
and
ma'am.
now I'm gonna remove the cotton ball and discard with this, and then check the injection site if there's bleeding. So there's no bleeding now. So sir, I'm gonna can I down this? Is it okay to down now this one?
Yes, ma'am.
Then cover the patients, and then also the blanket, to provide privacy. So now, I'm done with that. So before I'm gonna remove my gloves with using the proper technique. My left hands, I will grab the other hand, the right gloves, which is the right gloves. Then my one finger underneath of the left, this one like this, then remove. Then discard the gloves. So, discard the gloves. So now I will wash my hands. So before you leave, make sure that you have to provide comfort and safety to the patients. So I will lower the bed, and then raise the side rails. Then provide privacy, and you have to comfort the patients. So sir, how are you today? How are you after I inject the medication?
It's a little pain, ma'am.
Okay, that's normal reactions, ma'am. And do you have any concern? Do you have any questions?
No, ma'am. Thank you.
If you need something, sir, this is your call. If you need something, ma'am, this is your call bell. Just if you need help, just call us. So, do you have any questions before I go?
No, ma'am. Thank you.
Okay, sir. Okay, ma'am. That's all today. Thank you for your cooperation, and I will see you later.
Okay, ma'am. Thank you very much.
Okay. Now I will sign my MAR. So the 9 o'clock medications. The 9 o'clock medications. So I will sign ILC. My initial, ILC, Ibeluson, the Scabrilius, PNL. So practical nurse learner. So I will show you my MAR where I signed. So this is the 9 o'clock here. The 9 o'clock. So this is my sign. So this is the cyanocobalamin. So here. So cyanocobalamin, 1000 microgram, subcutaneous monthly. And then this is 9 o'clock. So this is my sign, ILC, PNL, practical nurse learner. So before I go, so I'm gonna clean up my things. So I will wash my hands, and that's all. Thank you very much.